Hello, welcome to my channel, Wellora Hub, your sure guide for health, wellness, and lifestyle. So today is for children. We're going to look at first aid kits that you need to have at home for children. Children are mostly vulnerable to accidents, diseases, illnesses, and a lot of healthcare challenges. All right. So we need to have these emergency kits at home to take care of some minor illnesses where applicable. Now, when the case escalates, we will need to take them to a medical facility for better health care attention. Now, later in the video, I'm going to tell you some scenarios or some cases or some situations that will warrant or need immediate medical attention. But for now, I'm going to give you the list of the things you need to have in your first aid kit when you have a child or you have children at home. So number one, we have basic medical supplies that you need to have at home in your first aid kit. You need digital thermometer with flexible tip. You need sterile gauze pads. You need adhesive bandages of various sizes. You need cotton wool or cotton pads. You need medical adhesive plaster. You need plastic bandage. You need antiseptic wipes or alcohol wipes. You need scissors with rounded tip. You need tweezers, and you need cold packs. It can be instant cold packs or reusable cold packs. Okay, so number two, you need child's safe medications. There are some basic medications, over-the-counter medications that you need to keep at home for your children. You would need paracetamol syrup. It's child friendly. You will need ibuprofen syrup. Let it be age appropriate. You need oral rehydration salt in cases of diarrhea and dehydration. We call it ORS. You need antihistamine syrup. You need cold cough syrup for kids or for children. You need nasal saline drops. You need zinc tablets or zinc syrup. Okay, so these are the medications you need. Basically, you need to have at home in cases of any health challenges, minor health challenges. Number three, there are wound care essentials also that you need to have in your kit. You need antiseptic solution, whether you're Dettol, Savlon, chlorhexidine. You need burn cream or gel, could be aloe vera or burnt ointment. You need antibiotic ointment like 3K triple action cream, penicillin ointment, or whitefield ointment. So any ointment that has antibiotic property, you have it at home. Sometimes you may need hydrocortisone cream that is of child strength. All right, there are hydrocortisone cream for children. So be able to identify, ask questions when you go to buy them. Number four, you have child emergency items that you need to also have available and accessible. One is flashlight, can be small flashlight or torch. You need disposable gloves, face masks, eye wash lotion solution, thermal blanket, child safe mosquito repellent, especially in the tropical part of the world like Nigeria. Mosquito is almost everywhere. So apart from other measures in prevention and treatment or care of children in mosquito exposed environments, having child safe mosquito repellent is a very good preventive approach. Right now, there are some extra things that you may have. They are important too. You can decide to have emergency contact list can have child's medication information sheet. This is a document that contains the basic information that one would need to know about your child. But sometimes it may contain allergies that will totally or at the long run help in assisting in their health care challenges. Now you would need a notebook and pen to have a simple first aid guide is necessary. After having all these things, I will make a video on how to use some of these things and how to tackle minor children illnesses at home. But for now, when you have these things, ensure that you do a proper check and survey, and also keep them in conducive environment. The storage condition is very important. So concerning the storage of all these things that I've listed, ensure that you keep it in cool, dry place. Now store out of children's reach. Check expiry dates every 3 months and label all items clearly. Okay, so, and as I've said before, that at the long run I will give you some ideas and cases that you would need immediate medical help immediately. So when you see these signs or cases or situations, you would need to seek medical help immediately. One is difficulty in breathing. When you notice your child is having difficulty, finding it difficult to breathe, you would need to seek immediate medical attention. Number 2, persistent high fever. You've given paracetamol or ibuprofen and it's not working, the fever persists, ensure that you seek medical attention right away. When you notice deep cuts or uncontrolled bleeding, when you notice large burns, when you notice convulsions, signs of dehydration, severe allergic reactions, these are cases where you would need immediate medical attention. So that's it for now. So ensure that you have these safety kits. Let them be accessible, let them be stored in a good condition for use. Don't forget to check the expiry dates and read the manuals for each of these materials that you have in the kits that will help you use them appropriately and when needed. Thank you very much. Subscribe to this channel for more.